management of multiple sclerosis MS. It is an autoimmune disease. It is a chronic, progressive, neuroinflammatory disease of the central nervous system and the spinal cord, which is inflicting the neurons and the axons of the central nervous system and the spinal cord. The immune system, especially the T cell, B cell and macrophages, crosses the blood-brain barrier and enter in the central nervous system and attack the normal myelin sheath, that is the protective layer of the axon and the neurons, which consists of normal protein. But mistakenly, the immune system of the body take it as foreign body or the enemy of the body. Consider it as a harmful and the negative to the body. So they produces inflammatory chemicals like cytokines. So a vicious cycle of inflammatory attack and battle occurs. There is destruction of the neurons, myelin sheath, and there is fibrosis. Multiple patches of the fibrotic collections scattered in the white matter of the brain. So this region is called as multiple sclerosis. The exact cause of the disease is unknown, but it is divided into two reasons: genetic predisposition. Due to the abnormal genes, there is lack of understanding or the capacity and ability in the immune system of that person suffering from this genetic disease. So they cannot differentiate between the friends and the enemy, or with the benefit and the loss of the body. They consider the normal myelin sheath as abnormal ones, and they attack their routine battle or the action against that one. The various risk factor for this disease is female gender, more common suffer. Then there is deficiency of the vitamin D, deficiency of the omega-3 fatty acid, fatty acid, omega-3 or 6 fatty acid, omega fatty acid, that is present in the fish and mostly the cod liver oil. Then there is smoking, obesity, the overweight and the diabetes. These are the various factors. They are considered as the risk factor for this onset of the disease. So there is no known cause of the disease. So there is no known treatment, or we can say there is no treatment for this disease. We can only control the progress and the severity of the symptoms and the disease by the medicines and the rehabilitation procedures. So it is of three types. The relapsing and remitting. Second is the secondary progressive multiple sclerosis. Then is the primary progressive multiple sclerosis. So these are the various stages or the types of the disease according to the the relapses and the remissions. So actual management is that we reduce the onset of the bouts, episode of the disease, which consists of muscular, sensory, and the cognitive disturbances and distortion in the activity. So we address the symptoms of the disease by the various medicines. So the medicine which are adopted or the use, that is the immunosuppressant and the disease modifying medicines. So these two groups of medicine are used to mitigate, to reduce the progression and the symptom and intensity of the disease, but it cannot cure the disease absolutely. So mostly corticosteroid in oral and the parenteral, that is IV or intramuscular route, they are also used. Cyclophosphamide, beta interferon, these are the medicine and the disease modifying drugs they are used to stabilize the patient, to maintain the almost activities, normal activities, not normal completely, but to certain percentage, the patient can live almost a successful life or comfortable life, though he cannot get rid of this disease altogether. So there is optic neuritis, there is paresthesia, there is muscle weakness, fatigue, there are tremors, paralysis, disturbance in the maculation, defecation, and the sexual activities. So these are the various deficiencies or the symptoms the person suffering from the disease is suffering from. And next is the cognitive abilities and the capacities, they are also disturbed and reduced. That is memory power, intellectual power, deciding power, thinking powers. Persons suffer from hallucination, depression. So we have to also treat these psychological factors. So overall, in addition to the medical treatment, we also adopt or the advice to the patient physiotherapy for to maintain the strength and the power of the various muscles or group of muscles of the body. And next, psychological complexes, there is also cognitive rehabilitation exercises and the procedures are advised so that person can get rid of depression, anxiety, and the deficiency in his power of decision and the thinking ones. So these are the various steps which are used to overcome the symptoms and to the intensity and progression of the disease. Up till now, this disease is of unknown origin and it has no complete cure to eradicate it. But there are steps, procedures, medicines that we can reduce the intensity, symptoms, trouble of the patient and the progression of the